A very good afternoon and welcome to our session on the topic breast cancer. We are glad to have Dr. Anshu Raina among us today to help us understand the topic. The doctor will take us through the crucial information and all the important points of the topic today. So stay tuned. If you have any questions, any doubts, anything, just post it on the comment section. We will take all the questions in the last of the session. So be there till the last and don't miss out on any information by our doctor. Doctor, you have the stage now.
Good afternoon, everyone. Myself, Dr. Anshu Raina, Senior Consultant and heading a Department of Obstetrics and Gynecology at Apollo Cradle Hospital, Greater Noida. So today I am going to tell you about a little crisp and knowledge about breast cancer. So, why we chose this topic to discuss breast cancer as on a open platform? Because it's very important to know about this disease, and the most important is if you will be aware about the this to diagnose the things and this disease, and it's easily preventable and treatable disease which can be prevented, which is nowadays the breast cancer is a number one cancer globally in a woman, and day by day the incidence is increasing. So by creating awareness regarding the treatment and the prevention and everything, so it will be easy to prevent the disease first of all, and even the disease you are going through the disease, it's if it will be detected early, it's easy to treat, and it can be treated, and the lifespan will be better if it will be detected in an early stage. So basically, idea about discussing on an open platform of this disease, as I said, because it's very much preventable disease, and how you can prevent that totally depends upon if you will be aware about the what are the reasons behind that, why it happening, what are the signs and symptoms, and how it can be prevented. Then only you are able to diagnose yourself and to meet your doctor. So, first of all, I just wanted to tell you the incidence is globally increased very much, and in 1 in 29 women are likely to have this cancer. And initially, it was in the elderly women, like over 50 years of days, but nowadays, this cancer is even involving the younger woman, and even it's seen in a 20s women in a 20s. And so nowadays the range is like between somewhere in 25 to 30 years of age and up to 80 years of age it can happen. So you have to be very very careful about this disease. So 30% of all new causes in female each year, as I said, increasing incidence in last 10 years, and 15% has significant history of family history, and they are more prone for a disease, as I said, because as we know there are so many other reasons behind that, but most very important is you should always aware about if there is any family history of breast cancer or any kind of cancer in your family. You have to be very very careful, especially the female should be aware about their history in a from a maternal side like mother, masi, nani, and if they have any kind of breast cancer or even a ovarian cancer in their history of ovarian cancer in family, they should be more careful about this disease. So it's basically linked with a breast cancer gene, which is if it's transmitted, that particularly called a BRCA1 and 2, a kind of gene. If it will be in a gene, it's inherited, and these people are more prone for the breast cancer in these part of life. So why it is so common? So if it will be like an environmental factor, so many factors responsible, not only a genetic factor, environmental factor, even the woman's age, which is very very important, the age at which you started your periods, that is called menarche. If the early menarche is there or late menopause are there, so they are the one who are very prone for the disease. So these things are there. Apart from that, the incidence is increasing. What is the reason behind that? The increased incidence is again dependent upon, as I said, the environmental factor is one of them. Obviously the inherited things are there, but apart from that, even in the inheritance was initially also there, but the why the incidents are increasing even in a young girls, that all depend, that is because of the environmental factor, what food we are eating and how we are exposed. So small things to be kept in our mind, the cosmetics we are using, the food we are eating. So these all are the things which is responsible. And along with that, obviously the age factor is there. Apart from age factor, the when you started your periods, either your periods get your menopausal thing is happen late. So these things are important. So how for now, if you how you can prevent this disease, if you will be aware about how you have to detect this, then it can be prevented. Or you should know what are the ways by which you can prevent it. So first of all, what are the ways you can detect yourself? So any kind of changes in your breast is noticed by you, then you have to just meet your doctor. So what kind of changes you should expect? First of all, you should be aware about your what is your normal appearance of breast. Then only you are able to make differentiate changes which is happening in your breast. So for that reason, so ideally the all girls should examine their breast or see in front of mirror every month. At least once in a month you have to stand in front of mirror and see your the what is the normal appearance of breast. And ideally, if any kind of history is there in family history or environmental factors, to which I said these are things are there, then you should also palpate your breast. And even for the this to be done even by all women, to palpate your breast in a post menstrual phase, and the videos are available on net, so you can know what are the ways by which you can palpate your breast to know any kind of mass or lump is there. If any abnormal mass or lump or any kind of small or big lump or any changes in your nipple, either it is retracted or any kind of discharge from a nipple, or any changes in size of your both breast is you are noticing, then you should consult your gynec and get yourself tested. And there's a test available for the early detection. Even nowadays there is a even a blood test which is available for early detection. And even the cancer is not there, there is a chances of cancer, then also it can be detected by doing few tests. That is a blood test, and that blood test is nowadays even available in India also. So the most important point is you have to be you should aware about by which it can happen and how it can be diagnosed. And anytime you diagnose any kind of these changes in your breast, you have to consult your gynec and get yourself tested and the further investigation to be done. So what are the ways by which you can prevent? So for that you should aware about what are the responsible factors for that. Nowadays the responsible factors starting from a age, as I said, the early menarche, the early late marriage, post-menopausal women, if the menopause is happening late. So these are the indicators where you have to be a little more careful. Apart from that, what are the environmental factors you should avoid? The environmental factors, as I said, the starting from your dietary habits, the lifestyle, you should maintain your healthy body mass index. Your the daily exercise should be there. You should not your use of plastic, that utensils, or use consumptions from the all the food item which used to be wrapped in a plastic shield, that should be avoided. These are the things which is a carcinogens, and as an environmental factor they can give you a more chance of leading towards the breast cancers. Apart from that, the prevention which can be taken, which should be taken by all women. So if women in a reproductive age group and childbearing age group, so they are after delivery, they should always towards more towards the breastfeeding, because that is the one of a thing, the woman who is more giving a feed to a baby. So lactating women are less prone for a breast cancer. So that's why, so nowadays in India, previously the incidence was low. Now because of our lifestyle, we the girls are not doing a breastfeeding. the chances, these again are the things which are increasing the incidence in a female. So these are the things which can be prevented by yourself if you will be aware about ki these are by which means you can prevent this breast cancer deadly things. Apart from that, you should also aware about ki you should not worry the moment it all that breast lumps are not a breast cancers. Always you should know about this. So for, it's not always that you notice a lump and you should be very in a panic thing situation ki you are having a cancer. No, it's not like that. All breast lumps are not always a breast cancer, but definitely you should get yourself tested. And yeah, if the your diagnostic parameters are normal, so you should be aware about ki what are the ways by which you can detect and what are the things to be done for that particular lump. But if the even the breast lump is detected as a breast malignancy or cancer, then also at what stage it is diagnosed, then accordingly the treatment modalities are available. So the most important is ki if it will be detected in an early stage, the treatment will be complete treatment is available nowadays, and even the customized treatment is available for as per the persons, like what is there, what kind of the cancer, breast cancer she is having, and what is the spread, and as per this that individual person accordingly the specifications and the special treatment is available for that. So important point in today's discussion is if it will be first of all, if it's a preventable disease, so you will be aware about what are the reasons by which. So as I said, the reasons which is responsible for this, if it will be that prevented, then it will be easily preventable. Even if it's not preventable, as I said, the another reasons is the genetic factor which can lead to. So even it will be detected in an early stage, then the mortality thing is less and the better prognosis is there. So early detection is equally important in this disease. So now coming to the other thing, so nowadays the patients are coming and get themselves tested and checked, and they are asking, is it how frequently we should go for the checkup? So ideally, after 30 years of age, all females should go for their that screening testing, which used to be done by the breast ultrasound, and that to be done even in a early stage, and starting from a 30 years of age. If there is no significant any history, the positive history like any kind of history related with the genetic breast cancers and all environmental factors, these things are not there, so you should get yourself tested ideally every year, if as a preventive checkup, so after 30 years of age. But definitely if there is a history of breast cancer or any kind of breast cancer in a family, especially on a maternal side, then the screening should be more vigorous. So these are the things to be kept in a mind. Now the things are what are the ways by which if the woman is already gone through the breast cancer, so what are the survival rates? So again, the survival rate is depending upon what kind of cancer, breast cancer you are having, and at what stage it was diagnosed. So accordingly they used to get a treatment, and they used to, the survival rate depends upon that. So these are the few things about the breast cancers, and if you want to ask any questions, you're open for that. So you can ask regarding these. Thank you. So for this, I can't see any question in my chat box. So now I just wanted to give a take-home message. So every woman should be aware about this deadly cancer, and it can be easily preventable. It will be if it will be that you have to, for that you can examine yourself by yourself every month for 5 minutes. If you can take out a time for yourself, so this disease can be easily detectable and preventable. So thank you so much.